When we think of marijuana, you may imagine a stoner that is greened out on their couch, laughing at everything and eating everything in sight. I'm here to tell you that there is a lot more to medical marijuana and marijuana in general than meets the eye. So I am here today to encourage you all to support the legalization of medical marijuana. Through this speech, you will understand the uses for medical marijuana and you can debunk some common misconceptions with medical marijuana. I have been researching this topic basically since it kind of became a thing because it's been more in recent years, so I do consider myself to be pretty knowledgeable on this subject. So first we're going to talk about the opioid crisis and how that relates to medical marijuana. Then I'm going to talk about some more specific uses for medical marijuana, what works and what doesn't. And then in the end, I'll talk about what could happen if this does not get legalized. So first, the opioid crisis. So we are in an opioid and narcotic crisis in our country right now. What is a narcotic, you may ask? This word gets thrown around a lot, so I just want to clear it up. The Drug Enforcement Administration describes narcotics as a substance that relieves pain and dulls the senses. And usually this term is used towards opiates. So they're kind of interchangeable. These medications are prescribed after surgeries, if there's an injury, and they are highly, highly addictive. So according to the American Addiction Center, the most prescribed and most abused narcotic is hydrocodone, also known as Vicodin. Other common ones are codeine and oxycodone, which is also known as Percocets. So the NPR actually released an article 2 days ago about how almost 60 doctors have been indicted on opioid pushing and healthcare fraud because they get money when they write prescriptions for these things. There was a doctor literally running a pharmacy in his waiting room, and there were patients who had no medical record of ever being physically examined, but they were prescribed these medications. So this led to 350,000 prescriptions totaling 32 million pills, which is enough for every man, woman, and child in Alabama, Kentucky, West Virginia, Ohio, and Tennessee. Now, if that doesn't blow your mind and scare you, it should. So this is also the deadliest drug crisis that our country has ever seen. To put that into perspective, there are about 130 people dying every single day from the abuse and misuse of narcotics. So what can we do to help? There has to be something that is better to solve our issue. My solution is medical marijuana. The National Cancer Institute is involved with the study of medical marijuana, especially as it relates to cancer. And you're going to hear a word called a cannabinoid, and that is basically the same thing as cannabis. It's anything that causes drug-like effects throughout the body. So Chris Hermes did a study which indicated, it was on WebMD, that showed 70% of physicians agree that marijuana should be legalized and that it has therapeutic qualities. So in 2015, Dr. Kevin Hill, he did a study of studies where he evaluated different things for medical marijuana, different disorders and things it could use. And he found that there were positive results dealing with multiple sclerosis, chronic pain, and neuropathic pain. And he found there was no correlation really when using it with Parkinson's, ALS, and Crohn's disease. But there were big things, and these studies did CBD and THC. CBD does not get you high, THC does. And it also studied the 2 FDA-approved cannabinoids that are on the market in a pill form. So along with Dr. Hill's study in 2015, the American Cancer Society has said that smoking marijuana can reduce the nausea and vomiting that is commonly associated with chemotherapy. Chemotherapy is hard to go through, so anything that can lessen these terrible symptoms is needed. So some common objections you might be thinking, well, what does it do to my brain? There is a study that says that young adults who smoke marijuana more heavily perform about 18% less with their short-term memory compared to those that don't. But again, that's recreational use. Medical use is more CBD. This could be higher in THC. And if that were the case, I think the benefits of losing a little bit of memory compared to struggling with seizures every single day, it's kind of a no-brainer. And another objection is, okay, what is it doing to my lungs? anything you inhale other than air will be damaging to your lungs. Not to mention, there are many ways to take medical marijuana, from eating it in foods or just using an oil that you put in your mouth. So, what can happen if we don't solve this problem? As you can see right here, in 2002, there were 10,000 deaths related to opioids. In 2017, that number shot up to almost 50,000. In just 15 years, that is a 40,000 death increase. I believe that if we don't stop this, and medical marijuana could help by prescribing that instead of these dangerous opioids, I think that number could go down, or at least stop rising. I also think the rates of HIV and AIDS and STIs would decrease, since there would be no sharing of needles. I also think pain could decrease, the economy could improve. There are a lot of things that could result from bringing this opioid crisis down and raising the marijuana crisis, raising the medical marijuana use. So, I want to tell you a story about a little girl named Charlotte. Just before she turned 2 years old, she had her first seizure, and it lasted for 30 minutes. And through that seizure, her parents found out that she had Dravet syndrome. And so a reporter with the last name Young at CNN, she wrote a story on this little girl, and she defined Dravet syndrome as saying that she has intractable seizures. An intractable seizure means that it does not stop with medication. So there has to be something else. Other than the seizure medication that they tried, she was on benzodiazepines and barbiturates, which are also highly addictive. And she was at the point where she was having 300 grand mal seizures a week. I can't even imagine that. And her heart had stopped so many times to the point where her parents had signed a DNR. So they were at the end and they were like, okay, we need to do something. So they turned to medical marijuana. They tried a low THC, a high CBD oil, and her seizures stopped almost immediately. Now she's 6 years old and she has maybe 2 or 3 seizures a month. And she's living a rather normal lifestyle that I was lucky enough to have as a child. So we need to fight to get these things legalized. The quality of life in our country could go sky high with these improvements. To summarize, the medical marijuana is really important to legalize. Personally, I have anxiety, and there are studies that have shown that CBD and possibly THC oils can help with those symptoms. So I hope to live in a world one day where I can have a natural remedy and not be dependent on antidepressants or anti-anxiety meds. So I want you to put yourself in someone else's shoes and imagine that it's your child going through this, and call your representatives to fight for medical marijuana. Thank you. Does anyone have any questions?
What's the level of THC in medical marijuana?
Honestly, that's a really good question, but I know typically with medical marijuana, especially if we're talking about seizures, it's going to be much higher in CBD. So you're not getting a child high or someone else high. It's more the CBD, because CBD has been proven to stop seizures, which is why this little girl takes it. I don't know the exact percentages, but that's a good question.
When dealing with the Cancer Institute, what is the biggest benefit is pain management, correct?
Mm-hmm. Yeah.
They're not using medical marijuana as trying to figure out a cure for cancer. It's just to help people make them healthy.
The nausea, the vomiting, and the general pain that patients are in when they have cancer. So it helps take a little bit off of their suffering.
And is there a proven cost savings when somebody is on medical marijuana to help with that nausea compared to the drugs that they're being prescribed now?
I would assume that there is. I would say that narcotics are far more expensive than a plant in marijuana. And they're much more even regulated now with the new medical marijuana dispensaries that we have in the states where it is legal. But it is much, much cheaper to use marijuana compared to other medications.
That's correct.
How many states do have legalized marijuana?
I want to say all but 5, but they all have different rules. Like we're in Florida, it's operational. Others are just CBD, and others where it's like they voted on it, but it's not been in effect yet. Like it's been passed, but it hasn't.